It's my pleasure to present an update on the clinical use of Momelotinib in patients with myelofibrosis as a part of the National MPN workshop hosted in San Antonio in 2020. Momelotinib is a unique JAK1, JAK2 inhibitor with particular use in patients with myelofibrosis and a particular niche in patients with myelofibrosis and anemia. Given that it has activity on the activin receptor, thus modifying hepcidin pathway and improving myelofibrosis-associated anemia. Our clinical experience with Momelotinib stems from the early phase clinical trials, as well as two large prospective clinical trials performed both in the first-line setting against Ruxolitinib in the Simplify-1 trial, and beyond first line, where Momelotinib was compared to best available therapy in patients previously treated with Ruxolitinib. These trials also have identified certain benefit that resulted in the design of the more recent Momentum clinical trial, where Momelotinib is being compared to the danazol for myelofibrosis with anemia. So to summarize the findings from the phase 3 clinical trials, there were mixed results in both studies. In the first-line setting, Momelotinib was statistically non-inferior to Ruxolitinib in splenic volume reduction. However, it did not meet that endpoint for symptom control, which unfortunately resulted in a negative study for the primary endpoint of the study. However, the study did identify an impressive response in anemia in this setting. However, this was not analyzed for significance given the fact that the study did not meet the primary endpoint. On the Simplify-2 clinical trial, where Momelotinib was compared to best available therapy, where 90% of the patients or so received Ruxolitinib. So basically, the study ended up being a Momelotinib versus Ruxolitinib in second-line setting. In this study, Momelotinib was not superior to best available therapy in splenic reduction. However, it was superior in symptom control. So the two trials showed mixed results. However, they both identified benefit in splenic volume reduction and benefit in symptom control that did not meet the preset endpoints. On long-term follow-up, the two trials included over 500 patients, showed good safety profile, and the peripheral neuropathy that was previously associated with Momelotinib did not become a limiting toxicity for this drug. A very strong observation had been the improvement in hemoglobin and the relatively reserved or lack of severe thrombocytopenia with therapy with Momelotinib, which makes this drug a very tempting option for patients with myelofibrosis and cytopenias. This led to the design of the Momentum clinical trial, which is a clinical trial of Momelotinib in second-line setting for patients with myelofibrosis and anemia, as well as myelofibrosis-related symptoms. So to summarize, Momelotinib has activity in splenic reduction and also has activity in symptom control. And it has a proven benefit in patients with myelofibrosis and anemia. It is being investigated in patients with myelofibrosis and anemia beyond first-line setting, where it's a niche that represents an unmet need and can be of great benefit to many patients with myelofibrosis.